This travel agency is now something of a crisis center. Jamil Ahmed working two phones at once with nervous Muslims who paid thousands to take the trip of a lifetime and are now backing out.
60% call is all the issue. What will happen? What will happen?
Every Muslim is expected to undertake the Hajj, a religious pilgrimage to sacred sites at least once. Yesterday, Ahmed cancelled 15 trips because of escalating tensions between Canada and Saudi Arabia. Saudi's national air carrier has cancelled all flights to Canada starting next week, which could strand hundreds of travelers there well beyond the end of the Hajj. Overstaying an approved visit to Saudi Arabia could land you a fine or time behind bars. Ottawa is still trying to figure out how many Canadians will be affected and what it can do to help.
I hope no one gets stuck, but if they do, I encourage them to reach out to our emergency watch center or call our embassy.
Some people are still willing to risk it. Fakhrizel Halim and his wife left for Riyadh today.
Now we have no idea how we are going to get back to Canada.
Still, Halim isn't worried he'll be stuck. He is, after all, a man of faith.
We ordinary people who are going for Hajj in 2019 have nothing to do with all this politics.
Malik Mushtaq is less confident. He estimates his business could lose millions in religious travel package sales if the two countries don't soon bury the hatchet.
As a Canadian, is our government and Saudi government, please solve this problem.
A solution which seems unlikely anytime soon. Katie Nicholson, CBC News, Toronto.
And travelers aren't the only ones who could pay a price for this dispute. Last night, we talked about the Saudi students who may soon have to leave this country, and among them, medical students who contribute a lot to our healthcare system. The University of Toronto has trained over 1,000 Saudi doctors in the last 40 years. There are 216 Saudi medical residents and fellows working in hospitals around the city. 225 are providing similar service in Montreal through McGill's medical program. In total, Canada has some 800 Saudi doctors in training. Pulling them out would likely put more strain on an already overtaxed system.